The real couch stretch is that your knee is in the corner, your front leg is up on a 30 or 40 centimeter surface, and your torso is upright, and you can squeeze your glutes very hard. I love 30-second holds. They can't hold their breath while they're doing it.
So Dr. Kelly, one of your trademark tests, which I can say is the couch test, which actually tests your hip flexors and hip extensions. So I want to know the science behind it and why you think it is really important for any age group, any athlete or any recreational athlete. Just let us know why it is so important.
The couch stretch is a test that we love because it doesn't require any equipment. It's appropriate at every age. And it gives me a lot of information about your ability to get your knee behind your butt. So like a big lunge or walking, right? You can imagine that that back leg has to go behind me into hip extension. And the couch stretch is interesting. Basically, we're going to put, if we were kneeling away from a wall, we would put one of our knees in the corner with the leg going up and down. So the leg is going up the wall, but I'm kneeling, I'm facing away from the wall. And what I should be able to do there is squeeze my butt, no problem, and I should be able to take a breath. Good. Now I bring the other leg up into a kneeling position. So the foot is up and I'm just kind of in a little bit of looks like an exaggerated lunge shape. What we're really doing there is just starting to flex the lower leg a little bit more, which does a lot to wind up the fascia, the musculature of the thigh. And then we ask ourselves, can you squeeze your butt and can you breathe here? And quickly what we find in that position is that people struggle in that low level test. And I'll be clear, the knee isn't even in hip extension here. This is a very, very favorable test.
Yeah.
And so if you're struggling with this, it tells us a lot about your inability to extend your hip, which says a lot about the tension in your hips, the tension in your knees, and more importantly, it will be very predictive of some of the forces on your lumbar spine. And so if you can't extend your hip, one of the reasons we see this anterior pelvic tilt and spinal stenosis and low back pain is that the pelvis will have to dump forward, to tilt forward to ameliorate or attenuate some of the forces when the hip is coming into extension. So if I crank your pelvis over, suddenly your pelvic floor doesn't work as well, your diaphragm doesn't work as well, your abs don't work as well. I take the musculature of your trunk and move it towards an extension end range where it's not very strong. The trunk really works best when it's organized in a more mid-range position. Your erectors don't work very well, and now suddenly you're just not as powerful. You don't have as many sort of movement options. And again, this is the easy test. The real couch stretch is that your knee is in the corner, your front leg is up on a 30 or 40 centimeter surface, and your torso is upright, and you can squeeze your glutes very hard. But one of the reasons I also love this test, especially for our runners, is that they can suddenly see when the hip is in extension in that position. Again, not the difficult test, but the easy test, is if they have a hard time squeezing their butt or activating their glutes, what we're seeing is you have what we call positional inhibition. That taking the knee into hip extension in that position is for some reason neurologically inhibiting your ability to squeeze your glute, which means you've lost the most powerful muscle in the body because your quads are stiff. So because your quads are tight or the fascia is tight, you suddenly can't squeeze your butt. That means your hamstring now has to extend your hip and extend your knee. And why do we see so many hamstring strains? Well, I think one of the reasons is that people's butts don't work as effectively as they could. So we are seeing, again, if I want to control the lumbar spine, I need to be able to control the butt. If I want to have more powerful hip extension, which is what humans do, we walk around or we run or we extend the hip, I'm going to need to have access to that position. And that's why it is a fundamental hip extension assessment that we want everyone to do. And the way to get better at it is to start spending time there. So if you struggle with that, you win 5 minutes a day of a little bit of couch stretch. You're welcome.
Now, as far as I can understand, there is a strong relation between your hip mobility and your longevity. As you mentioned, there is a lot of chances of fall as you age, especially post 60 or 65. So let's say there is a person who is not having a good amount of hip strength, both flexion as well as extension. So what will be the exercise implementations or the interventions you would like him to do so that his hip strengthens itself?
we can borrow from classic strength and conditioning. And the first thing that we can do is we can slow people down and have them work in their available ranges. And it's okay to hold on to something. So someone could squat holding onto a sink. Someone could lunge in between two counters with their hands on something. And what we like to do is simple isometrics for starters. So I love 30-second holds. 30 seconds is a magic number. And not because the research says 30 seconds is the best, but it's long enough that someone has to be really demonstrate control in that position, and they can't hold their breath while they're doing it. So we love that the exposure is long enough. So one of the things we could do is say, hey, let's get you spending some time actively in these range of motion controls. Again, everyone can do that. But then what we can start to say is, where and when are we going to put this in? And if we need to start strengthening the hips, that might just be, let's get you walking up some stairs, right? That might be, hey, in between some bench press, I'm going to have you hold a couple weights and we're going to step up onto this box. We're going to teach everyone we work with how to deadlift, so how to pick something up off the ground. Beautiful ways to strengthen the hips. And then we're going to practice the squat. And it may just be air squats to a depth where they have control. It may be that we're going to have them carry something or hold something while they do that. I'm a huge fan of using sandbags for teaching people to squat. They can grip the sandbag, they can carry it. We don't even have to go to a barbell. Giving them a single dumbbell, and instead of goblet squatting where they hold it in the front, I have them hold it with two hands on the shoulder. Now we've got this uneven load. They've got to problem solve. So there's a lot of ways to train that. And then for a lot of our athletes, and especially people who are a little bit older, sometimes we don't get a good bang for the buck for just making the weight heavier on the bar. We need to back squat. We need to back squat heavier and heavier and heavier. Instead, I think one of the things that we can do is say, hey, let's go ahead and give you access. Let's challenge the shape, but while we're breathing hard and doing something else. So one of the nice things that we can do is say, hey, let's do a little sprint, or let's do a little run, or let's do some cardio demand, and then we'll challenge your squats. And again, even simple sets of 5 and 10, however much time you have under loading. And we can, if we did that a couple times a week, we can really make significant change.
दोस्तों, ये वीडियो अगर आपको वैल्यूएबल लगा तो इसे लाइक कर अपने सारे दोस्तों से इसे शेयर कीजिएगा। इस चैनल को सब्सक्राइब तो आप कर ही लेंगे। चलिए मिलते हैं।